Tess with Rowe Dental Lab, and today I want to talk about something that has been on the horizon and the talk of the town: Locator Fixed and Removable. They're two great options when it comes to your full arch cases. So when do you pick which option, and kind of where does each one come into play? So you have a patient who's presenting, they need extractions in their teeth out, and you tell them that they're going to have to be in a removable denture, and we know the feedback usually that patients give with that. They've seen stuff about it being fixed or not moving around or falling out, and they're interested in something implant retained, but maybe don't quite have the budget of fixed full arch. Your first option is going to be Locator Overdenture, which is amazing. It has less cost associated with it since it's typically less implants. We're restoring with an acrylic material versus a zirconia, so again, another factor kind of bringing the cost down, and usually a couple less visits when you go to restore that case. So it's a good middle of the road option for your patient who needs to be in a removable prosthesis but doesn't want something that's falling out at dinner or that is moving around when they're talking and engaging with their friends and family. The nice thing about this too is that they can pop that denture out at night to make sure they're getting underneath it and cleaning it. We know the challenge sometimes we can face when we have patients in something fixed, that they're not always the most diligent about removing it and taking care of it. So for those patients who did struggle with care in the past, it's a great option for them that is fixed when they need it to be and removable when they need it to be when it comes to cleaning it. Now, if we graduate to the next step up, we now have Locator Fixed, which is another great option for your patient who can't quite go all the way with All-on-X and a vinyl zirconia prosthesis, but still wants something fixed. This option is going to be exceptional as well, since you and your team kind of can help them through the hygiene appointments, being that they come back into your office to get the prosthetic removed for you to go ahead and clean under it, inspect the implants, make sure everything's looking great underneath that prosthesis. And this also can be something that you graduate your patient to. So perhaps right now they can only afford 2 implants, so we move them to an overdenture, and then a couple years down the road they have a little bit more money, we place 2 more implants and move them to Locator Fixed. That is something we see sometimes, where those patients graduate from Locator Overdentures to then Locator Fixed. So between those two services, Locator Fixed and Removable, it offers a gap in the industry where the patients, want something but may not be able to afford it at this time. It gets them into something fixed so that they feel comfortable about their smile and the prosthetic that they have. If you're interested in learning more about Locator Fixed or Removable, our technicians would love to talk with you about records, parts and pieces, or however we can support you. I know that a lot of these cases in the implant fixed industry is kind of on the rise, and a lot of people who may not have an implant background are looking to restore these cases, and we want to be there as the lab to walk you through these cases and answer any questions you have so that you and your patient both feel confident in the restorative process. So again, any questions, please feel free to call into Rowe directly. Thank you so much for tuning in, and we look forward to your next Locator case with you.